what are some of the most common contributing factors? I know that you said that the 7 different subtypes have different causes. So what would you say are the most common factors that are usually on your radar when you're investigating, ADD cases?
To start off, genetics is a huge contributor, right? So there's this concept called heritability in medicine, and heritability refers to how much of this condition can be attributed to genetics versus environment. And so heritability is scored on a scale from 0 to 1. 1 would mean genetics are the only thing at play. 0 would mean genetics have nothing to do with this. For ADHD, the heritability is between 0.7 and 0.9. So actually, there is a strong genetic component to ADHD, so much so that most people with ADHD will have at least one first-degree relative that also has ADHD. Okay, so genetics play a big role, but it's not the whole story. Other factors that contribute are anything that reduces blood flow to the prefrontal cortex or increases demand on the prefrontal cortex. So examples, head injury, 100%. You can have someone who goes through a head injury who never had ADHD before, but now is functioning as though they do have ADHD. And the reason for that is brains are very soft. They're the texture of room temperature butter. And so if someone hits the front of their head, the skull stops moving, but the brain slides forward, and you get a buildup of pressure and a reduction in blood flow. So head injury is a common example. Toxic exposures, toxins can reduce blood flow to the brain, including the prefrontal cortex. So things like drugs, alcohol, but environmental toxin exposures too, like mold, heavy metals, paint fumes, pesticides. These things all have an impact. And if you look at, our industrialized society and all the things that we clean our house with and put on our bodies, and if you actually sit down and read the labels, those are things that we probably shouldn't be putting in our bodies. And that goes for food too, by the way. Nutrition has a monumental role in ADHD. And to go back to your previous question about is ADHD on the rise, nutrition has a big component in all that too. So those are some factors to think about.